And welcome to this month's quick blog summary video. This month we are covering the benefits of pool therapy once again, but more specific for the realm of breast cancer. Last month we covered the benefits of pool therapy, just generalized for all cancers. So once again, we know that this is an amazing form of exercise that when people are feeling a little bit limited with land, it opens up another opportunity to try exercise in a different form. Pool therapy can really help in a breast cancer journey with helping patients to just move easier, decrease pain, and simply feel better. We know that in a breast cancer journey that there can be many breast cancer treatment related conditions. This can stem from the very start from chemotherapy. You can get chemotherapy-induced neuropathies. It can go more into kind of radiation treatment side effects, radiation fibrosis, into cording, a stiffening of the shoulder. Sometimes post-surgery, there's pain and stiffening of the shoulder. There can be neuropathies that onset, symptoms related to the hormone therapy, such as nausea, dizziness, lightheadedness, and weakness, and so on. So there's many stages in a breast cancer journey. I like to call these phases kind of the 5 phases of rehab. And throughout all these 5 phases, there can be a variety of conditions that arise, all of which are listed on my website, or most of which are listed on my website. And pool therapy can be a great option for a lot of these conditions. Whether it's post-mastectomy, post-surgery, or post-radiation, or in hormone therapy, pool therapy can help. So we know that pool therapy generally in the breast cancer population can really help to improve mobility of the shoulder and the thoracic spine, which is your upper back. Often post-surgery, there is kind of a tightening of that musculature. There is a protective pose that we like to be in and kind of posturing and pulling those shoulders forward, and pain can make us do that as well. That can cause kind of a stiffening sometimes of the shoulder joint and the upper back or even the neck. We know that the buoyancy of the water just kind of takes the impact off the body. It helps patients to be able to move with less load and less kind of impact going through their joints. So this can often just kind of free up movement that doesn't exist on land. Through buoyancy, patients can then mobilize their shoulder, their upper back, and even their neck a little bit more in the water, and this can lead to just general improved mobility of the shoulder and thoracic spine. Of course, we need to bear in mind with pool therapy the stage of wound healing. So if someone is post-operative, you'd want to consider consulting with a cancer physiotherapist to understand when a pool therapy program could start for you. So we know that whether you're post-surgery, post-radiation, and there's maybe some stiffening of the shoulder or the upper back, pool therapy can be a great option to build mobility and range of motion. So we also know that pool therapy generally just decreases pain. So how does it do this? Well, we know that there's this buoyancy force that kind of takes the load off, but we also know that there's this nice pressure that happens when we're in the water through hydrostatic pressure. This is kind of like how a brace works. It's a little bit of a hug to your joints. So as all your body is kind of being hugged nicely, the brain interprets that as safe. And when the brain is feeling safe, it's less likely to protect you and therefore create pain. So the water and pool therapy is a really great environment for patients to often just feel better. They find themselves moving with a little bit more ease and just feeling a lot less pain than they would on land. So that's a really awesome kind of side effect of pool therapy. Whether it's a stiffening of the shoulder or a more complex breast cancer related condition like we talked about, sometimes pool therapy is the first place that patients just feel like they're able to move forward with that condition and achieve some movement and better pain management. So water can help joints feel safe, leading to less pain. We know that pool therapy also improves endurance and stamina. We talked a little bit about this last month. I'm just going to repeat myself. So endurance is this idea of kind of being able to do things for long periods of time. Running, cycling, walking are example of endurance activities. You know, it is important for us to be able to kind of have the ability to do that when it comes to managing cancer-related fatigue. So for patients that are struggling with fatigue or aspiring for a return to work but not feeling a lot of stamina, you know, getting into the pool is a really great opportunity to try to start to build a little bit of that base of that light exertion over longer periods of time that maybe they're not able to tolerate on land. Maybe walking is still a little bit too limited, a bit painful, but you feel like you can pace yourself a little bit better in the water, you have less pain and so on. So pool therapy and having a pool therapy program can really help to build muscle endurance over time and stamina This can lead to faster returns to work, better posture, better standing tolerance, better walking tolerance, and so on. The one downfall of pool therapy, however, we talked about this last month, is that it's actually very hard to build true muscle strength in the water. You aren't working against gravity, so you're not getting a progressive overload of your muscle tissue. So when it comes to building bone density and counteracting that impact of hormone therapy within breast cancer, a true strength-based training program on land is really important. So that's where I don't say that pool therapy improves strength, but it improves muscle endurance and stamina. Strength and bone density are more achieved through a consistent routine strength training program on land. Another beautiful impact of pool therapy is that it reduces swelling. Pool therapy can kind of help the muscles act like little pumps because you're doing little movements for a long period of time, and those little pumps can actually help to start to move the swelling around, decreasing swelling as a whole. Or stubborn swelling that hasn't moved around for a very long time can finally start to get kind of mobilized as you're able to move more than you ever have or for longer periods. So swelling can be greatly reduced through regular pool therapy. This can also help generally with lymphedema and just kind of general edema as a whole. Breast cancer patients can see this sometimes suprabreast, underneath the breast, into the lateral thorax, into the back, into the shoulder, even into the arm, hand, and so on. You can see generalized edema or presentations of lymphedema. And the pool can be a very powerful place to start to mobilize some of that fluid around and promote reabsorption. If you have any concerns about lymphedema, of course, that is a separate condition with which a certified lymphedema therapist can diagnose and provide education and support with. But still, I have worked with many patients who do have lymphedema and find the pool to be a very great way to manage it. Last but not least, of course, pool therapy improves cardiovascular health. We know that within some types of cancer diagnoses, if they're HER2 positive as an example, patients might undergo a Herceptin regime, and Herceptin can be cardiotoxic, having negative impacts on heart health. So getting back into a good, slow, graded approach to aerobic training can really start to increase and improve heart health, which is a great way to kind of countermeasure the impacts of treatment. And the pool can be a very safe and well-managed area for you to start to do that, where pain won't be so much of a burden. So we know that the pool is a great place for getting your heart rate up. Unfortunately, sometimes within a breast cancer journey, bone metastases can occur. This means that the cancer has spread to various bones in the body. Most likely, this presents within the spine. When patients have bone metastases in their spine, they often report this as very painful, and they're limited in their walking tolerance. They're limited in their standing tolerance at times, or even sitting tolerance. I love working with this population, especially in the pool, because it can often be the first time that patients report a little bit of pain relief. We can achieve decompression of the spine in the pool through buoyancy, and it's often the first time that patients have experienced a little bit of pain relief in quite some time. And often the water, through its buoyancy, can allow patients to move a little bit, get walking, elevate their heart rate, and so on, and then experience all the benefits that exercise and pool therapy has to offer. So this can be a very powerful tool for those with bone metastases. So once again, thank you for listening to my little blog summary. I look forward to connecting next month. Thank you for your interest in science and rehab.